Thank you, Chairman Scott and Secretary Becerra. Before I begin my questions, I want to thank you for the guidance that HHS recently issued granting more flexibility for the provider relief funds. I wrote a letter to you with my colleague, Representative Asney, asking the department to issue this type of guidance. And this much needed flexibility will allow providers to fully use the provider relief funds as they continue to recover from the impact of the COVID-19 pandemic. So thank you in the department for the guidance update. Also, Secretary Becerra, on May 6th, also Dr. colleague, Dr. Murphy, who you recently heard from, and myself, wrote to the CDC Director Walensky asking questions about the troubling information that had come to light with respect to the role the teachers' unions had played in altering the CDC school reopening guidance. A response to that letter was requested by May 20th, but we have still not received a response a month later. Mr. Secretary, can you tell me what the Biden administration is worried about revealing, and will you commit to us to get us a response to that letter within the next week?
Congress, we absolutely commit to get you a response as quickly as we can. We'll work with you. If we'll try to make sure we keep your team updated on where we are. A critical question, all of us, whether it's our teachers or whether it's our children in school, and certainly the families who will see these kids come back home after being in school. We all want to make sure we're protected and don't see COVID flare up again. So we'll try to get back to you as quickly as we can. By the way, thank you for your work on the Provider Relief Fund, because we listened to a lot of your all comments in making sure we came out with a guidance that would be helpful in regulations.
Thank you again for that. And given the number of children that have committed suicide while schools are closed, I think it's extraordinarily important that we actually are listening to the science rather than the teachers' union. And that's particularly troubling in light of the public testimony Dr. Walensky gave subsequent to our letter. She testified that teachers' union input on guidance was limited to, quote, what happens if you have immunocompromised teachers, close quote. However, the emails uncovered showed that the union's influence went well beyond that issue. And so if you can explain, if necessary, and correct the inconsistencies between the testimony of your CDC director and the CDC emails.
Congressman, I can tell you, knowing Dr. Walensky, that she and her team at CDC used the agency is critical, and they make sure that they use all the science they have before them to make the decisions for the CDC. That's one of the reasons why I think we're able to come out of COVID, because CDC has based its actions on the facts and science before it to guide America and how we move forward.
And given how critical the CDC is, of the additional $1.6 billion budget increase for the CDC, can you commit that a significant portion of that will be directed directly to non-competitive local public health care grants, so our local public health officials get the assistance they need after having worked 24/7 through a pandemic?
I commit to work with you. I don't want to commit anything in terms of CDC's allocations, because I obviously would want to talk to Dr. Walensky about that and her team, but we can commit to you that we'll do it in a transparent way so you and others can see exactly how we are allocating those resources.
Thank you. There were also troubling reports earlier this year that the HHS was placing unaccompanied alien children with sponsors in the U.S. before background checks were completed. Today, are all sponsors of unaccompanied minors, unaccompanied children receiving background checks prior to placing a child?
Congresswoman, I want to guarantee you that under my watch, and certainly under President Biden's watch, every child who is discharged to a custodian, a responsible sponsor, has had that background check done before we release that child.
Thank you. The AP reported in March that the Biden administration was waiving FBI fingerprint and background checks for staff and volunteers at temporary influx facilities who directly care for children. Today, are all caregivers at temporary influx facilities being fingerprinted and getting background checks prior to working with children?
Anyone, Congresswoman, here I can assure you again, anyone who works for the Department of Health and Human Services, and especially with regard to the care of the unaccompanied migrant children, goes through all the appropriate and legally required checks before we allow them to work with us. We have different categories of workers, obviously, some who have direct care services, some who provide the oversight of the discharge process and the review of files. But we make sure that anyone at HHS or who's employed by HHS has gone through the appropriate checks before they can be employed.
So you would agree that a lack of background checks on caregivers and a lack of fingerprinting increases the risk of physical and sexual abuse of children at the border, and having unaccompanied minors dropped off at the border does increase their risk of human and sexual trafficking?
we are not going to do anything that imperils the safety of a child. And I think, and at least in the few months that I've been secretary, I think we've proven that we are doing this in a way that not only protects the rights of these kids, but respects their rights as well.
Well, thank you so much for answering my questions. And I would also encourage you to visit the border, and I yield back my time.